Hi, I'm a.zile, a second-year PhD student at the University of East Anglia, and this is a short presentation about my systematic review of student mental health disclosures. So, there's been much discussion and work around student mental health and stigma on university campuses, and acknowledgement of the fact that universities have a duty of care to students, which includes providing suitable accommodations and support for students who might be struggling with their mental health. However, forms of support such as specialist mentors, extensions, or adjustments within the course require students to formally disclose their mental health status to their university. And as such, it is important to consider the issues around disclosing and disclosure practices when looking at any type of help seeking, intervention, or statistics around student mental health. There is a discrepancy between the numbers of students who we think are experiencing mental health concerns based on large-scale research studies, anonymous polling, and those who formally disclose and access support from their university. To understand the issues surrounding student disclosure of mental health and how it impacts on help seeking and access to support, a systematic review was conducted and registered on Prospero. In total, 36 pieces of grey and published literature were included, with research coming from Australia, the USA, the UK, Canada, South Africa, and one large-scale multinational study. The studies varied in their methodology and their participants. Some focused on specific cohorts, such as undergraduates or postgraduates, medical students, or staff. Some studies included a mixture of both staff and students from a range of backgrounds and faculties. The studies highlighted themes of stigma, resources, knowledge, the role of staff knowledge, and staff needs to support student mental health, the burden of disclosing, both emotionally and financially, awareness, issues of information sharing, and concerns about the future and what happens to anything that students disclose about their mental health. In terms of impact, the systematic review identified specific student characteristics that can impact on mental health disclosure decisions and disclosure rates, such as gender, LGBTQ+ status, student ethnicity, international student status, the parity between physical disability and mental health disclosure, and the subject area in which students are enrolled. The themes and characteristics identified from the systematic review are key points for both universities and researchers to consider. Alongside this, researchers should also consider the discrepancies between disclosures in anonymous research studies or polling versus formal disclosure rates to institutions, why that comes about and what we can do when interpreting results around student mental health. Also important is the impact of clinical or subclinical levels of distress and the importance of a diagnosis. This should be considered in both research design and interpreting findings, as many students may not be able to access a mental health diagnosis or even know that their distress is at clinical levels that could be diagnosed. We also need to think in terms of research reporting and design of how disclosure processes impact student mental health, why students are more likely to report mental health within an anonymous research survey, and how that shapes our view of what the findings mean. And here is some contact information if you'd like to talk through anything from this presentation or have any other questions about my area of research. There's also the contact information of all three of my PhD supervisors. Thank you.